And just let that shoulder drop, please. Just let the head fall. Very nice. How'd that feel? It's a big one, man. Coming down towards me and just let that shoulder drop. Perfect. Just let the head fall to the right. Very good. Awesome.
This is a procedure that we do in our office for patients that have non-healing defects on the front part of the ocular surface, or for patients who have severe dry eye disease. This procedure entails applying a dehydrated amniotic membrane on the front part of the eye. An amniotic membrane is tissue that is derived from the surface of human placenta after a healthy birth. This tissue is harvested at tissue banks where the donor is evaluated for communicable diseases. So this tissue is healthy. We started out by numbing the patient's eye with an anesthetic. We then had to open the patient's eye with a speculum. This helps the patient keep their eyes open during the procedure. After drying off the cornea, we then place the dehydrated membrane on the front surface of the eye. After smoothing out the dehydrated amniotic membrane on the front surface of the eye, we then add a specialized contact lens over top of the membrane. This membrane and contact lens will stay in the eye for up to 2 weeks, depending on the issues going on with the patient's eye. The patient is put on a topical antibiotic during the time that this is placed on the eye. The speculum is removed and the patient returns to clinic in 1 to 3 weeks, depending on the amount of defect on the front surface of the eye. This patient returned to clinic in 1 week. The contact lens was removed, the membrane had absorbed into the eye, and her issues had resolved. Friday afternoon, patient walks into my office with decreased vision, new onset of large floaters, flashes of light, and foggy vision. Here it is. It's a retinal detachment. This is bleeding and pigmentation. There's the detachment. Let's take a closer look. Here's a close-up view of the big, large floater that's fogging up his vision. This consists of pigmentation, blood, and floaters. As you can see, it is going over his central vision, so it's definitely blocking his vision, causing lots of blurriness. Here is the retinal detachment. As you can see, this large tear right here, this part of the retina or the tissue in the back of the eye is actually lifted up. So there's a lot of fluid collecting in that area. This will have to be fixed, so he's going to a retinal surgeon for surgery. If left untreated, the retina will completely detach and patient will lose his vision. This is one of my dry eye patients that suffers from frothy tears or bubbles in his tear film. That means he has an excessive amount of bacteria in his tears and on his lashes. Here is a close-up view. Look at all those bubbles. To treat this, I use a hypochlorous acid spray to control the amount of bacteria on the eyelids and in the tear film. This is one by Optase. They make different kinds. So basically what you do is you close your eyes, you hold about 6 to 10 inches from your eyes. It takes a little bit to get used to. You let it dry. You do not bite. You blink twice a day.
I think first grade.
First grade, and he said it never came out.
Yep, that's a rock.
I can actually hear that.
That's a rock, folks.
Sit by myself, talking to the moon.
Pull up the thing gon' turn up. 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 Ooh, yeah, come for this ooh. Yeah, give her the wood. Yeah, ooh, come for the zoo. Pull up for surgery. Yeah, come set the mood. Come the sunshine, yeah, come make the move. Baby, go find so fine, might give her the wood.
Nice. Okay.
Ja. Kom hier. Daar is. Ah, ja. Zo cool.
Heb je gehad, jongen? Rustig. Nice.
Hier komt deze kant. Kom hier. Yes. Hier is carnaval. 2022.
Kijk, stuk, man.
Zie.
Hulp, man.
Yes.
This Chiropractic was removed from a wild rabbit, although this parasite can affect pet rabbits as well. This condition is known as cutaneous myiasis, also known as warbles or bots. Adult flies lay eggs on the rabbit's fur, which later hatch into larvae that bore through the skin. Once they reach a certain size, they then burrow into the ground where they pupate and later emerge as adult flies. When Zuko first came to my hospital as a stray, he was in desperate need of medical care. His right eye was badly traumatized and unsalvageable. The best thing for him was to have it removed. Once he was under anesthesia, my technician cleaned and prepped the area for surgery. I performed a transpalpebral approach, where the eyelids are sutured shut, an elliptical incision is made around the eyelids, and the globe and all secretory tissues are removed within the conjunctival sac. Once the eyelids were sutured together over the globe, I make my incisions and bluntly dissect away the conjunctival sac. Now, multiple ligaments, muscles, and nerves must be transected to release the eye. It is important not to use excessive force or traction, as this can put pressure on the optic chiasm, causing blindness in the other eye. Once the eye is removed, hold pressure to stop any bleeding and breathe a sigh of relief because you're almost done. All that is left is to close the incision in multiple layers. The transpalpebral approach is my favorite because it's much easier to remove the secretory tissues, such as the eyelids, conjunctiva, and nictitating membrane. If left, these tissues will continue to secrete and cause complications. Zuko was a little sleepy after his procedure, but after spending the night in the hospital, he was feeling much better. I decided to adopt him and was eager for him to meet his new family. He quickly made himself at home, filling up on food, relaxing and making biscuits, and of course, getting lots of cuddles. We slowly introduced him to his big brother, Iro, and his fiery personality quickly came out when he found his favorite toy. Now he is completely recovered, and he couldn't have been a better fit for our family. Here I am expressing an ear hematoma on a 160-pound St. Bernard. These hematomas occur when a blood vessel in the ear bursts and blood pools between the cartilage and skin. Unfortunately, her ear hematoma did not respond to medical management alone, so a quick procedure was performed. There are many different ways to perform this procedure. To hold the sides of the ear back in place so that it does not refill, some vets use sutures, some use buttons, drains. Well, I usually use these tacks that were specifically designed for this procedure. Most vets will then bandage the ear flat to the head, which I also did but did not film. One of the most important steps is to treat the underlying cause of the hematoma. For most dogs, it occurs due to head shaking caused by ear infections. Luckily, she made a great recovery and was back to her playful self in no time. This woolly opossum was anesthetized for a tail amputation procedure. Due to an infected injury, the decision was made to amputate just the tip of the tail. Here, one of our technicians is cleaning and prepping the area for surgery. After dissecting between the vertebrae, I closed the wound with some sutures. South American woolly bare-tailed opossums are sometimes kept as pets and are a different species than the wild Virginia opossum that you may see in the United States. They do have similarities though, being nocturnal, omnivorous, and of course carrying their babies in a pouch. This one was owned by my good friend Catalia. Fortunately, we only had to remove the tip of her tail, and she went on to make a complete recovery.